I'm Peter Libby, the Mallinckrodt Professor of Medicine at the Harvard Medical School and a cardiovascular specialist at the Brigham and Women's Hospital in Boston. Well, for me, the art of medicine, and one of the satisfactions and the reasons that I continue to practice, is the approach to the patient and listening to the patient and learning from the patient. And if we listen carefully, that it can help us get to the right diagnosis. And in management of cardiovascular disease these days, there are so many forks in the road. There's so many different directions. And you have to listen to the patient. And it's my job as a doctor to be the guide to the patient on this journey through cardiovascular disease. I believe that the disease, atherosclerosis, is changing in the current era. My current working hypothesis is that plaque rupture is tamed with our current therapies and preventive measures, and it's solved in principle. Now, we have a long way to go to implement in practice a lot of the knowledge that we've gained, but from an intellectual perspective, plaque rupture has lost interest because I think we understand it, and we understand how our contemporary therapies and preventive measures are reducing it. So I think another mechanism of causing blood clots in atherosclerotic arteries is on the rise. And we call it superficial erosion. It's been known for many years, but it was thought to be a minority cause of blood clots. And I think that the current clinical evidence is teaching us that superficial erosion is on the rise. And so our laboratory is now working very hard on a whole different set of biological principles that we think apply to today's and tomorrow's disease, not yesterday's disease.
It's very, very rare that you find somebody like Dr. Libby who is equally at home at the bedside and at the bench. And what makes him so successful is that he is inspired by the problems that patients present and takes the problems to his laboratory.
My own approach to doing research is very much inspired from patients. I'm a clinical cardiologist, I practice cardiology, and I would say I derive a great deal of inspiration and motivation from the bedside. Of course, I also am engaged in large-scale clinical trials, so I'm concerned about populations and prevention on a global scale, but it's always the one-on-one contact with patients that I find most inspiring. And so I've always started with the clinical problem, and an important clinical problem, and one that's unsolved. And then I tried to think about it in a fundamental way rather than accept it as we see this or this just happens, and try and understand at a mechanistic level what it is that causes the clinical problem. Well, one of my great passions outside of my profession is music. I'm a great fan of classical music, and of course Beethoven was completely mad, and following his madness through his music gives you an incredible insight into someone who was an enormously innovative creator, and his courage in breaking idols and to forge new pathways is a model for the kind of courage we need in many sectors of life, including in research. So these people are my friends. I feel like I'm a soulmate of Bach, of Mozart, of Monteverdi. I was listening to Monteverdi this morning while I was exercising. Unbelievable insight into the human spirit and depiction of the struggles of the human soul, the joys, the sorrows, the pain. And Schubert, he's another buddy, you know. So I feel that these are my friends, and each of them speak to me in a different way, and I learn something from each of them. And I feel very fortunate that I understand, to a small degree, their language. If I really had talent, I'd probably be in music, but I'm just a doctor.